Hello. So during my ambulance ride, I had a 91-year-old woman who was on a unit at U of M. She had stage 4 lung disease, so lungs presented with crackles and wheezes. She was on hospice care and did not have a lot of time left. She was definitely on her last couple of hours. She had agonal breathing and really low O2 at levels between 70 and 85. This patient's respirations were irregular with periods of apnea. Blood pressure was not taken because it was not needed at this point. She did have telemetry with a heart rate that varied from normal sinus to sinus tachycardia. I saw it as low as 60 and as high as 200 at resting. This is because her body's trying to compensate for all these changes. The patient presented to be extremely pale, which makes sense with her vital signs. There was definitely not enough perfusion to vital organs, so this is where things are starting to fail and go downhill. The family wanted to transfer her to a hospice facility, even though there was a strong possibility that she may not survive the bumpy ambulance ride. We did not do a full health history on this patient because it is not needed when they are on hospice care. The goal now is different. It is to keep them as comfortable as we can. We are no longer trying to improve their health. So the reason for our care was the family wanted to transfer the hospice patient to a hospice facility, like I mentioned. She was already on hospice care, so the main concern now was pain management. We were pushing morphine every 2 hours. Another concern was that if this patient were to die on our way to the other facility, the ambulance would need to take this patient to the closest morgue due to protocol. The paramedics made sure to explain this to the family because this isn't usually what one wants, although the family did agree to it still and followed through with the transfer. So the interventions that were used were, first off, the daughter of the patient was able to ride along with us to spend the last little bit of time with her mom. We did support the patient with O2 through the nasal cannula temporarily just for the ambulance ride. Once we got there, she was no longer going to be on O2. So the ambulance driver drove slower through the traffic until we were about halfway and things started clearing up. So just to try to control the bumpiness, since this can really affect the patient. According to the MedSurg book, 6th edition by LeMone and other authors, pain is a common problem for the end of life. It is also stated that the most important thing we can do for these patients is provide comfort care, especially through pain management. Knowing this, we were aware on how often to give morphine and how much, but she was not with us long enough to where we actually needed to push the morphine. She got the morphine right before we left, but she was getting 1 milligram every 2 hours. She seemed really comfortable the entire time. We had the patient hooked up to telemetry to watch her heart rate and make sure we knew if she passed away. Lastly, we had a warm blanket on her because she was already so thin and sick. She's already not perfusing well, and heat kind of helps the perfusion in the body, so the little bit we can do, the better. We also kept an eye on her face and did the face pain scale. So I feel like most of all the possible interventions that were done, that needed to be done, were done. Although when we were doing pain management, I did not see any non-pharmacological remedies for treating pain. A study was done in 2016 that showed the use of a valid pain rating scale was relatively low at 69%, which we did do the face scale, which was good. In the study, 95% of patients received pain medication who reported pain, but only 42% of the patients that did report pain received non-pharmacological therapies. So maybe the use of a non-pharmacological remedy for pain could have been useful during the ambulance ride. Something like relaxing music could have been useful. This kind of takes the pain away by you bringing your mind to something else. So I noticed that all the healthcare teams worked really well together. The nurse gave a really good report to the paramedics, and the paramedics were not afraid to ask questions if they needed more information. The paramedics made sure to go over the risk and what will happen if the patient were to die along the way, since this is a huge something most families would like to know. Even though most healthcare staff disagreed with the family's decision, they still supported their request and did not treat them any differently. Lastly, though, when we finally got the patient safely to the hospice facility, the staff there were almost mad that we transferred this patient. They were nice to the family and the patient, but towards the paramedics, they were kind of grumpy. Although it's not necessarily the paramedics' fault, they were just doing their job. It's our job to support the patient's wishes, no matter if we agree to them or not. It's what the patients want, and we have to do the best we can to support those wishes. All right, that's all I got. I attached the references I had on the book and the journal I had at the bottom of this video.